Good afternoon. It's Tuesday, January the 19th, 2021. Sagal, David Lahash, UJets. Welcome to today's COVID-19 Task Force update. And on this show, our 169th, we will be talking to Lloyd Phillips, Commissioner of Public Safety. We'll also be talking to MCK Chief Gina and Lisa Westaway, Task Force member, and also the Executive Director of the KMHC. So without further ado, here is Lloyd Phillips.
Thank you very much, David. Good afternoon, everybody. Well, before I start, I just want to first and foremost express my condolences to the family of Patricia Snow Loft, who had a tragic incident yesterday. My sincere condolences to the family, and I know, especially during COVID times, it's very difficult for everybody. But also, I also want to mention, as the Public Safety Commissioner and fellow paramedic and a father of one of the injured paramedics, I wanted to also express my gratitude to the paramedics and all the first responders out there who put their own well-being on the line every day to protect all of us. Whether that be their everyday job or especially during COVID times, they're also putting themselves at risk, for the benefit of all of our people. And they experienced a tragic event yesterday, which is probably one of the worst case scenarios that a paramedic could experience. So I wish them all a very speedy recovery. Thankfully, there was no serious injuries, and I offer them my support and whatever we can do to assist you and during this hard time. So with that said, changing topics, I just want to first of all mention that I'm glad to report that we're starting to see the trend of new cases going in a more positive direction. By positive, I mean they're going in a downward way. This is true within the community, and certainly even more true we look across the province. They had cases today reported, which was the lowest since December 4th. So it seems that the trend in which the cases were moving is starting to bend. It's starting to take a trajectory in which we collectively hope it was going to take. And the same thing goes for our community. We currently have 6 active cases in our community. We have approximately 40 people in isolation, but that's still much better than it has been just in the past few weeks. So hopefully, again, we're seeing that trend in the maintain and stay in that positive direction. We took several preventative measures for the month of January with the hopes of seeing a positive outcome. We understand that these measures are tough on everybody. It's tough on the economy. It's tough on individuals' well-being and their personal lives, and we do not take these measures lightly. And as we said several times, we take the directives solely for the protection of the health and safety of our community. Now, that is our mandate and that is our primary goal. But we can't ignore the fact that sometimes the directions that we take do have impacts on the community as a whole. And I'm talking about individuals in their work, business owners, it impacts on them, and also the community as a whole, because there are millions of dollars of community funds that are being spent to support businesses and individuals during this hard time. So there's many things that we also have to take into consideration. We're already in mid-January, believe it or not, and we want to be planning for the next phases. When Directive 55 expires, we always want to be looking forward at the next steps. What has to take place in order for us to achieve the goals of keeping our community safe and to minimize the impact on our community. We have a very diverse business community in Kahnawà. I think we all know this. We even have a more diverse people. And when we put directives together to try to address a particular circumstance, or in this case, businesses, we want to put a directive that would certainly cover the vast majority with one directive or one statement. And then, knowing how diverse everything is, You can't capture everything in one stroke of the pen, so to speak. So what we've been doing is, and we've been doing this since last March, and then we'll deal with individuals on a case-by-case basis to resolve whatever the issue may be, and that's been quite successful since last March. Unfortunately, and certainly, it is no secret, with recent events, with fines being issued to a business, business being reclassified, many factors being considered, including interference from the outside, that had angered many people. But decisions made by the task force are based on the best information that's in front of us. We need to make unbiased decisions. And yes, sometimes it even goes against our own personal feelings on the matter. But we need to be unbiased, and we have to continue to do what we feel is proper based on the information that is in front of us. We have been doing this for the past 10 months, and we will continue to do it until the end. I just want to be clear that Directive 55 is still in place, and all businesses in the community are currently adhering to it. I want to thank the business people for the cooperation. And even though somebody is operating as a convenience store, they are not permitted to sell tobacco products to non-locals. If that is the case, the peacekeepers will intervene and do what they need to do. The objective of the task force is to ensure that the directives are followed by the community, which will in turn protect the community, which will in turn minimize the spread of the virus. That goal was accomplished with Directive 55. I had to go through some tough times, but the goal was achieved. Our community is as safe as we can be at this point in time. And like I said, things are turning the corner, and things are looking much more positive moving forward. I don't foresee the need, we haven't received any requests for any more reclassifications, nor at this point in time do I see a need to have any reclassifications done. I want to focus on moving forward. I want to focus on getting the vaccines to our people. I want to focus on ways to safely reopen businesses. I want to focus on ways to safely return back to our families. I know we've been through some tough times, but at this point, we have to stay the course. We are getting closer to the end. We got to stay the course. Thank you very much.
Thank you very much, Lloyd. Next up, we have Chief Gina Deer from the Mohawk Council of Kahnawà. Gina?
It's good to be back. I just want to give the community a bit of an update and also to give a message from the Mohawk Council of Kahnawà. Today we had a meeting and we also had a press release to support the directives of the task force. Specifically Directive 55. There's been a lot of controversy in the community over what has happened in the opening of a convenience store that had been recategorized from a tobacco store. We want to first off thank everybody who's adhered to the directives. For the most part, people are, and it's going well. We know it's going well because the numbers are coming back down. We have had a lot of inquiries as to why the community, business community specifically, wasn't consulted when this had happened. Well, nobody can forecast what's happening. It's very important for the task force to be able to respond to rising numbers, for instance, and that's what's happened in the latest closures. The numbers have been rising. We had to respond. The task force had to take into consideration health and safety first and foremost. That's the priority. So again, they've done what was necessary. The numbers are coming down. There are people in isolation, and for the most part, again, as we had said, people are cooperating. Now, we had one instance where there was a ticket that was issued. We want to remind people that Kahnawaga's jurisdiction is the jurisdiction that allows us to operate. And that jurisdiction should not be questioned in these times. We are here because of the collective. And again, safety and security of our people is first and foremost. Monies come secondary. Nobody's life is worth any amount of money. And that's what it boils down to. When I came on the task force in the past, we've talked about monies that have been put into the KERM fund to protect businesses and individuals who are in need of funds. So again, Mohawk Online has had the ability to help inject some more money into the fund. We are here giving what we can back to community to protect the businesses so that when the opening is allowed, they can resume business again. And specific to the tobacco industry, we know that the people will be back. There is a clientele that is just waiting for us to open back. The mom and pop shops don't know what the future holds for them. So through the KERM fund, we've been helping take care of the bills that are necessary so that they can resume business, and we hope their clients will come back. We all have different issues, but we have to respect what's being done by the task force, because to date, we haven't had loss of life in our community. And in one of our sister communities, they have recently had some loss, and we haven't faced that. And we don't want to face that. And we have to thank the task force for doing that. They've taken some dramatic steps in the past. People may not have been in agreement, but it's been in response to what's happening in and around the community. They can't forecast that they need to close, so they're doing their best to respond. As a matter of fact, I think they have taken on more than they should have, because we have just dumped everything in their lap. We have said, handle this, do this, make a decision here, make a decision there. They did not ask for all of this. When we mandated them, no one could anticipate what the future would be for them. We have to respect the decisions that they have taken, because they have kept this community safe so far. Our numbers are so minimal. At one point, we had 0 cases. Health professionals outside of this community that I had spoken to were amazed and said, why don't we know about that? Why are you not talking more about that? And that's through the task force directives that we've gotten to the point that we are at. The KERM fund was part of the recommendation of the task force, saying we need to help businesses and individuals, and we're doing that. We're trying to help people who need it, and that's what's key here, if you need it. We've also had brought to our attention that some people are traveling. People who are on the KERM have money to travel, and it's a concern, because we had put this together for people who are in need. It's not just extra funds for people, and we've been taking a lot of flack about the fund. Now, the fund is available when the task force mandates businesses to be closed. If your employer has decided to close themselves for whatever reason, that is on your employer. But when the task force mandates a closure, you will be covered by the KERM fund. Now, the second closure has taken a lot of time for people to process applications, and the monies are coming in. But apparently not quickly enough, because we had received several complaints that people are not going to receive funds. You are, and unfortunately it's taking a little longer to process the amount of applications, because there are actually new applications, people who did not apply before and said, well, this time I decided, you know, I need the money, I've used my savings and I'm going to apply, and that's fine. So January, with a mandated closure, you are entitled to the full amount of $2,000. The last payment, though, will come during February, as they are processing payments. So we ask for patience. We ask for patience, and we ask for support for the people who've been working behind the scenes, because there are many. I want to remind people that nobody thought we would be where we are today this many months later. There are people who've given up holidays and weekends to ensure that the things that need to be taken care of are taken care of. We can't forget that. I know people are angry and upset, but let's give each other respect. Kahnawake, we're a people of respect, and sometimes through frustration we forget. But we are here for you. Give us a call, ask questions, voice your concerns, and we'll try to work through it together. So nyawa goa, ona.
Thank you very much, Gina. Up next is Lisa Westaway of the Kahnawà Memorial Hospital Center. Lisa?
Good afternoon. So I have a few updates for you today, more medical in nature. The first that I wanted to talk about is our symptom log. So we've spoken often about COVID-related symptoms and when you should come and get tested. So we wanted to give a few specifications about those symptoms so that you can better evaluate when you need to come and get tested. As you know, on the website that we have, on the KMHC COVID-19 website, we have a symptom log where you can self-assess and help you know when you need to call in to be tested. So we're making a few changes because what we're noticing is that due to our COVID fatigue, we are oftentimes trying to put off getting tested, or we're saying, oh, you know, that's probably not COVID. I'm not going to go and get tested. And then we're going into work sick, or we're continuing in our daily activities sick and therefore transmitting the virus to someone else. Another reason why people are not being tested is because, as we know, and this shouldn't be the case because this is a virus, but as we know, there is a big stigma against having COVID-19. People don't come to get tested because they're afraid to actually be positive. However, in order for you to all be part of the solution, in order for us to all be part of the solution, we have to limit transmission. And if you recall, several months ago, we talked about the main elements required to limit transmission of COVID-19, and that is to be able to identify COVID-19 cases quickly, self-isolate, and identify contacts so that we can have people isolated and therefore not transmit the virus. So if we're not testing people who are sick, then we're not able to identify people who have COVID. Just a few stats right now in the Montérégie area. If you go and get tested, or if you have COVID-related symptoms, whether you're tested or not, you have a 1 in 4 chance of actually being COVID positive. That's how many cases there are right now in the Montérégie area. Some areas of Montreal right now are a 1 in 2 chance of having COVID, simply if you have symptoms. So please remember that right now we're not seeing many other viruses, but we are still seeing a common cold and we're still seeing COVID. Those are the two rhinovirus, those are the two viruses that we're seeing, rhinovirus and COVID-19. And they are very, very similar in symptoms. Therefore, if you have symptoms, you need to be tested. So this is the staff symptom log, and it's what we're using everywhere. In all of our businesses, and this is going to change as well in the businesses. So if you're an employee of one of Kahnawake businesses, then you'll be using this symptom log starting end of the week or early next week. We're using it as well at our community organizations, at KMHC, KSCS, MCK. So this will be sent to everybody involved so that the staff symptom log can change. But you at home can use this log as well, and this is the one that's on the KMHC website. So remember, if you have one of the top symptoms, new or worsening cough, fever or chills, difficulty breathing, sudden lack of taste or smell without any nasal congestion, then you need to call and be tested. When you're completing this form, you're looking at the last 24 hours. So an employee of an organization or of a business, for example, they complete this every single day. So you're not just completing it based on your symptoms at the moment that you're completing it. You have to imagine and evaluate your symptoms over the last 24 hours. So many of the new COVID positive cases that we've seen lately that have caused transmission to many other people or have had many contacts have either been asymptomatic cases or have been cases where somebody may have said, well, I kind of had a little bit of a cough last night, but when I woke up this morning, I was feeling fine, so I went to work. That's an example of a situation where you've had one of those symptoms in the last 24 hours, and therefore you need to call and be tested. You should not go into work. We are seeing very mild cases right now, and therefore anybody who has these symptoms could have COVID. Again, 1 in 4 chance. So the second set of symptoms is actually you should have either one of the above symptoms and one of the lower symptoms, or 2 of the lower symptoms. So I'll just read them. New onset headache, new onset pain, which could be muscular, chest, abdominal, or joints. New intense fatigue. So we're seeing a lot of people who are tired, who are COVID positive. New severe loss in appetite, sore throat, or gastrointestinal symptoms like diarrhea, nausea, or vomiting. So if you have 2 of any of those symptoms in the last 24 hours, so sometimes you won't have them at the same time. You might have a headache, and then your headache will go away, and a few hours later you might have a bit of a sore throat. So you don't have 2 at the same time, but you may have both within the last 24 hours. That's the way you need to analyze your symptoms. I would encourage all of you, whether you are going into work, whether no matter what you're doing in your day, to evaluate your symptoms using a log like this on the KMHC website if you can. Have someone print it for you so you can do it at home. But evaluate your symptoms every day so that if you do need to be tested, you can call and be tested. There is no shame in having COVID. Anybody can have it at any time. Anyone can transmit it at any time. The important aspect is that we take control of what we can control, which is to stay home when we're sick, to self-isolate when we've been tested, and to follow all the recommendations of public health. So those are some changes that are happening to the symptom log that we wanted to talk to you about today, and that you'll be hearing from your employer or through the website very shortly. I also wanted to talk about some changes in daycares and schools. So actually in this symptom log is used a little bit differently in our schools. The reason for that, and this is only here in Kahnawake, this is not something that exists in Quebec, but in all of our schools, in our daycare, we do the staff, both the staff and the students, complete this symptom log every day. It is monitored by a group of people, and anybody who is sick must stay home. However, there's a small change that is being recommended by the Minister of Families, the Minister of Education, within schools and daycares. And that change is with respect to how we behave for contacts of contacts. So let me go back a little bit and explain to you what I mean here. In the past, if somebody in your household was being tested for COVID-19, the children would still go to school until the results of their family member was received. And then if they were positive, they would be considered a contact and they would stay home. So that is a change that is being made now. So if somebody in your household is positive, then the children would not go to school or would not go to daycare until results are received, until that family member's isolation is lifted. So it could be an older brother, it could be a sister, it could be a parent. Either way, this is an extra precaution in our schools to limit transmission of the virus. With respect to the symptom log, the extra precaution in the schools is that if anybody, either employee or child, has one of any of those symptoms, whether they be in the top of the form I showed you or in the bottom, they do stay home and they wait 24 hours to see if they develop any other symptoms before being tested. So just the major change there, and you'll receive a memo from the Kahnawake Education Center. It's coming out today if it hasn't already. It's a communique that's going to look a little bit like this. And it's very specific. If any member of the household currently is awaiting a COVID-19 test result, they should keep their children home until they have received their results. So the symptom log that's being used for the Ed Center and for daycare step by step will have that new question on it for you to complete. Okay. Next, I'm going to go back to stigma and blame just for a quick second, and thank you to Gina and Lloyd, who spoke a little bit about it before me. But I did receive, the task force received a concern call from a family, an ironworker family yesterday. And I thought that, and they did give us some important information that I thought would be important to share. So we've recently found out that there are some companies in the States that are doing PCR testing, so that's like our regular lab testing of all of their iron workers on a weekly basis, and they're doing a rapid COVID-19 test on a weekly basis as well. So some of Kahnawak's iron workers who come back every weekend are actually being tested twice a week at their workplace, and they have the results and they have their forms with them that demonstrate that they have been tested and that they are negative. So those particular workers are undergoing screenings in the same way that all of our employees at KMHC and KSCS, inpatient, T-Bell, ILC are going through, and therefore they also have an agreement, as far as I know, with the border control, so they do not have to isolate when they come home on the weekends. They are doing their screenings every single week and twice a week. Now, this is not everybody, but these are some people, and it just brings about the need to worry about ourselves as individuals, what us and our families are doing, but to not always be so judgmental of other people around us. We don't always have all the information to be able to make those judgments, so I thought it was important to mention that today. Another change. So today, or actually this week, INSPQ, which is the research arm of the public health in the province, released new directives regarding masks. And this is really in response to the large amount of cases, outbreaks within the different communities. And after evaluation, we have chosen to put this in place as well here in Kahnawake, in order to follow, of course, the science that INSPQ brings to us. And this change is with respect to KMHC and KSCS facilities. So starting at the end of the week, we just need to get this, put this in place, but I wanted to give you some advance notice. Starting at the end of the week, any user who comes into one of our facilities will be asked to take off their cloth mask, and they'll be given a procedure mask. So it means that any users in KMHC or KSCS facilities, starting at the end of the week, will be wearing procedure masks when they're inside our buildings. So I just wanted to let you know so that you're not surprised when you come to the buildings. You will be handed a different mask, and that's going to be starting at the end of the week. So a bit of an update regarding cases. We have presently 6 active cases in the community. We continue our screenings of our employees at KMHC Inpatient, Elders Lodge, and ILC so that we can catch any early COVID-19 symptoms prior to transmission to residents. Some really good news today as well. We were able to lift the isolation for all of T-Bell residents, so that was done earlier today. And that signified as well the end of the outbreak at Turtle Bay Elders Lodge, so we're really happy that we were able to contain all the hard work from staff, both KMHC and T-Bell were able to work together and contain the virus and contain the outbreak. So that is really wonderful news as well. So really thank you to everybody who works so hard every day to continue to make our community safe. And of course that includes all of you. The numbers really demonstrate that we've been working hard, but we cannot let down our guard. We have to continue to do this for the next little while still before we can say that we're out of this risk. So So keep up the hard work and be patient. Okay, thanks.
Thank you very much, Lisa. And just before we go, we have a couple of things we'd like to bring to your attention. Revenue Canada will be hosting a free webinar tomorrow. It's at 2 p.m. It's a free event. It's to discuss some of the issues and programs and benefits that are available from the Government of Canada. However, you must register for this webinar. We'll be posting the link on the description of this video. And one final thing before we say goodnight, we'd like to thank the community and the business owners and those in the tobacco industry for your continued support for following Directive Number 55. And that's it for this edition of Kahnawake 911. From all of us here, Yawagoa, Danu, Onagiwahi.